So these are the miscellaneous drugs under endocrine, and I'm just gonna specify the things that you have to absolutely remember. So under estrogens and progestins, as you can see, I provided this information for you, but definitely use this as a reference for the future. Maybe if you want to read more about it, but definitely you don't have to memorize all of this. The only thing that I want you to remember when it comes to these hormones, estrogen and progesterone, is that one, there's a black box warning, especially for patients with a history of cancer pertaining to breast, uterine. So anything that can be influenced by these hormones. In addition, hypertension is another black box warning. This can actually exacerbate or worsen existing hypertension or even possibly cause hypertension. And in addition to that, there's also black box warning when it comes to thromboembolism, including CVA or stroke, MI or a heart attack, PE, which is pulmonary embolism, DVT, or deep vein thrombosis. So that's the only thing that you have to know when it comes to estrogen and progestins in this class. Now, you will most likely learn more about this when you go over your OB or women's health rotation. Next, let's talk about biphosphonates. The mechanism of action of biphosphonate is inhibiting bone reabsorption by inhibiting osteoclastic activity. So what does that mean? So it means that it prevents the bone from breaking down. Therapeutic effect is decrease in bone loss. Studies show that when a patient is on biphosphonate, it actually reduces hip fracture, spinal fracture, or basically different kinds of fracture by almost or approximately 40 to 50%. So there's a strong evidence of the reversal of lost bone mass, and then that it reduces fracture risk. Indications for this, it can be treatment and prevention of osteoporosis. So sometimes if we do a bone scan on a patient and we see that their bone density is low, even though they're not considered osteoporotic yet, we may have to put them on this medication. And so sometimes it's used to prevent, but sometimes we use it also to treat a patient who already has osteoporosis. So those are the reasons why we give this medication. Now, Paget's disease of the bone, this is a chronic bone destruction or disease that causes chronic bone destruction. So this is also a case wherein we may be giving biphosphonates. And lastly, hypercalcemia in the blood. So hypercalcemia in the blood, what it does, it basically pulls that calcium back into the bone, therefore decreasing the calcium level in the blood. Precautions and contraindications. So this medication can actually cause esophageal erosion. And because of that, when a patient takes this medication, they need to stay upright for the first 30 to 60 minutes after they take that drug. Because again, this medication can irritate the esophagus. And so if they have to take this every day, can you imagine if it causes constant, daily irritation in that area? So over time, this can cause esophageal erosion. So we don't want that from happening. So we need to instruct our patient to make sure that right after this medication, they shouldn't be laying down. They should stay upright. In addition, caution with esophageal stricture and upper GI and liver disorders. So some side effects. Side effects, again, esophageal erosion, so it can upset the stomach as well, can cause nausea, diarrhea, gastritis, and so on. It can also cause headaches, arthralgias, joint pains, and electrolyte imbalances. When given IV, this can cause osteonecrosis, the tissue death of the bone. So this can happen in the jaw area, so it can cause some loss of bone in the jaw area. So we have to be very careful when administering this IV. The medication that you have to remember under this class is alendronate, or also known as Fosamax. So alendronate is the generic, and that's the one that you have to remember. Under men's health, let's talk about 5-alpha reductase inhibitor. So 5-alpha reductase inhibitor, it works by inhibiting the conversion of testosterone to the androgen DHT. So the prostate development and alopecia is dependent on DHT. So just by knowing that alone, you know what this medication is affecting, right? The prostate and hair growth. So the therapeutic effect, it can increase prostatic testosterone level. And on the other hand, it decreases PSA, which is prostate-specific antigen, and DHT, which is dihydrotestosterone. In addition, it also decreases scalp dihydrotestosterone. Indications or reasons why we give these medications include BPH or benign prostatic hypertrophy, prostate cancer, and alopecia or hair loss that's caused by androgens. Precautions and contraindications. So just remember, this is teratogenic. So do you recall what teratogenic means? Teratogenic, it can affect the developing fetus. So a pregnant woman or somebody who's trying to be pregnant shouldn't be handling this medication. In addition to that, another precaution or contraindication is liver disease. Some side effects include loss of libido, erection problems, and myopathy. Examples of drugs in this class that you have to remember is finasteride, and it goes under the brand name Propecia or Proscar. So finasteride is a drug that you have to remember. The next drugs are phosphodiesterase inhibitors. Phosphodiesterase inhibitors work by promoting smooth muscle relaxation and inflow of blood. So the therapeutic effects of this medication is for penile erection and pulmonary pressure. So mainly increased pulmonary pressure. So this decreases pulmonary pressure. So this is given in cases of pulmonary hypertension. So indications, erectile dysfunction, again, pulmonary hypertension. So some precautions and contraindications. So another absolute contraindication is if somebody is taking nitrates. So which ones are your nitrates? Nitroglycerin is one of them, right? So if somebody is on those medications, on nitrates, in any form, whether it's sublingual, it's a pill, it's an IV, we shouldn't be giving this medication. So phosphodiesterase inhibitors and nitrates shouldn't go together because this causes profound hypotension and may actually lead to death. As you remember, nitrates can drop your blood pressure pretty quickly, right? And quite severe. And phosphodiesterase inhibitors, that's the same thing. That's why we shouldn't be giving it together. Now, other contraindications include possible heart disease, myocardial infarction, cardiovascular accident or CVA, or stroke. And again, why is that? Because of the side effects. So the side effect is hypotension. So some of you may have heard the names of the following medications. So you may have heard of Cialis, Viagra, right? So those are the medications that we're talking about. But the medication or generic name that you have to remember is for Viagra, which is sildenafil. So again, the medication that you have to remember is sildenafil. Next is alpha-1 adrenergic receptor antagonist. So you may be familiar with this medication because we've partially covered it, or we did talk about it in the previous units. I believe it was unit 3. Anyhow, so alpha-1 adrenergic receptor antagonist, the mechanism of action is smooth muscle relaxation of the bladder, neck, and prostate. So therapeutic effects, it opens the urethral opening, right, therefore facilitating urination. So indications, so when do we give these medications? So we give these medications in the presence of BPH or benign prostatic hypertrophy, and sometimes we also give it when patients have kidney stones or renal calculi. So it facilitates the passing of those stones, right? So it prevents the opening from spasming, therefore allowing for the stones to pass a little bit more smoothly, preventing more discomfort. Now, some precautions and contraindications, because it causes smooth muscle relaxation, it can relax the vessels as well. So we have to be very careful when giving it to patients because it can cause hypotension. Hypotension can also lead to kidney problems. So we have to be cautious when giving it in the presence of hypotension and renal impairment. So again, side effects, hypotension, low blood pressure, dizziness, and sedation. So sometimes this can have sedating effects or side effects. So we have to be very careful, and it's very important to make sure that the patients are safe, especially when we first start them on these medications. Examples of drugs that we have to remember for this specific unit, you have to remember tamsulosin. Again, the drug that you have to remember for this unit is tamsulosin. Lastly, anabolic steroid or testosterone. This is just for you to refer to. If you want to read more about it, definitely use your book or use this outline. But the very important thing that I want you to remember when it comes to this medication is basically similar to what you have to remember with the female hormone. So when giving this hormone, testosterone, right, we need to keep in mind the black box warning. So what is it? This medication, in the presence of cancer, it can actually cause or worsen cancer. So that's why ideally when providers or doctors start patients on testosterone, when this is prescribed, they have to check the PSA levels or the prostate specific antigen, because if it's elevated, usually they shouldn't be giving this, right? Because of the risk for cancer. In addition to that, hypertension, it can make blood pressure higher, or even worse if they already have existing hypertension, and as well as thromboembolism. So this specific hormone can actually thicken the blood because it promotes more production of red blood cells, therefore putting the patient at more risk for CVA or stroke, MI or a heart attack, PE or pulmonary embolism, DVT or deep vein thrombosis. So those are the things that you have to remember for this specific drug.